Hello and welcome back to my channel. I have actually been gone for a while and I am here to tell you why. So first off, thank you for coming back. Two, thank you for all my new subscribers and everybody who has commented on my previous videos. Today's video, I will go ahead and give you guys a full warning. There may be some graphic details. There may be some embarrassing words, but this is my hysterectomy surgery story pretty much. And that's the reason I have been gone for a few weeks, is because I had a hysterectomy. And this will tell you all about my surgery, what happened, my recovery, how I'm doing now 2 weeks post-op. So first, to get started, I did have my surgery on November 13th. That was on a Wednesday. And I had arrived at the hospital at 6:30 in the morning, got prepped. Funny enough, I had to pump my milk before because I had fed the baby off of the non-dominant side and it was pretty full, so I had to pump. And the nurse was joking around that that was the first time that had ever happened, because nobody really goes into surgery and asks to pump their milk. Anyway, so I did that. My surgery was at 7:45. I met with the anesthesiologist who, funny enough, looked like the very young, like 80s version of James Spader, but sounded like Matthew McConaughey. Imagine that. Really, really nice gentleman. One of the male nurses I had was actually the same male nurse I had when I did my tubal. Yes, I did have a tubal, and now I have a hysterectomy. We weren't sure if insurance was going to cover the hysterectomy, and we were trying to help out my cycles a little bit more, although I heard conflicting things that tubals can make your cycle heavier. But because we didn't want any more children, or at least I can't really due to my health issues, we went ahead and went with the tubal. But I had the same male nurse I had for my hysterectomy as well as my tubal. So we chatted about our kids, because he has a young one as well. And said my goodbyes to my husband. Well, gave him a kiss. He left and went back to his parents, which is just 2 minutes down the road, to sleep because it was early. Got rolled into surgery, and from what I remember is one of the male nurse was across the room getting things prepped. Anesthesiologist was talking to him, and that's pretty much all I remember. I don't remember moving over to the table. I don't remember him putting the mask on. I don't remember anything. So I woke up and it was 11 o'clock. At least when I woke up, I looked at the clock and it said 11. I remember shaking terribly. I was freezing cold. The operating room is between 30 and 60 degrees, so that pretty much does not help any. There were two nurses, a male and a female, and I remember their names, but I'm going to keep their identities just in case, secret. But I remember the female kept saying, "She's cold, we need more blankets," put blankets all over me. I swear I probably had like 7 blankets on top of me. I pretty much had like, all you can see were my eyes. That's pretty much all you can really see. And they were talking about the breast pump and whose it was or where it would go, because they wanted to take it up to the room with me. And I remember them calling my husband and having to leave a message saying, "Hey, it's so-and-so, give us a call back. She's out of surgery, she's in recovery." And shortly afterwards, there was a phone call back. I'm assuming it was my husband. They let them know surgery was fine. I was being wheeled up or rolled up to my room. And I believe they gave the room number. I can't really remember that much. And we went to the room upstairs. It was the mom and baby floor, just because I had a hysterectomy, so they knew better to take care of me. And I remember seeing the lactation consultant who I had with my 2-year-old, as well as who I saw with the infant. And I thought I waved, but my hand really didn't go anywhere, probably because of all the blankets. And she came into the room, asked how I was doing, got me comfortable. And I want to say within 5 minutes or so being wheeled up to my room, my OB came up. Here's where things get interesting. she came up and was like, hey, I just want to let you know surgery went well, but you took about 6 years off my life. And that is exactly what she said. And I kind of looked at her really confused. I'm like, oh. And she said, yeah, your heart stopped twice during surgery. Which scared me because I had my tubal and nothing, from what I recall, happened during my tubal. And so that really scared me. And she said, her words were, she said, you vagaled out. There is a vagus nerve that runs from your gut to your heart to your brain. And she said, I vagaled out. But most people faint, like the sight of blood, when they're stressed out, when they pass a really big bowel movement, they pass out. But I did worse. I was a little bit more dramatic. And so she said, but you're fine. Surgery went well. She kind of explained what she saw when she was doing surgery. She said she had pictures she would show me the next morning. And we went from there. She left. The lactation consultant nurse came back in. And because I was on a morphine drip, I hadn't been on it very long. But because I was on a morphine drip, I would have had to pump and dump, which really upset me, but whatever. And she went to go set me up so I can pump, and I remember grabbing my chest, and even to this day it still hurts. And she goes, oh my God, are you okay? Are you okay? I'm like, yeah, my chest hurts. And I explained to her what my OB had said, that I had actually pretty much died, and they had to do chest compressions. And she goes, oh my God, that was you? There was a code blue throughout the hospital. That was you? Your doctor didn't say anything about that. Let me go text her. So she like ran out and texted her. Came back, and I was asking where my husband was and telling her I need my husband, I need my babies. So she let me use her cell phone. I called him, got a voicemail. So she texted him and said, hey, this is so-and-so. She's up in recovery. Here's her phone number. Call her on the hospital phone. She gave me the hospital phone, and within a few minutes, he called back. I picked it up. I'm like, hey, I need you here. And I was like hyperventilating, I was crying, and I told him, I said, I coded out during my surgery. And of course he was a little upset because he would get text messages throughout the surgery saying, your wife is in surgery, your wife is doing good, surgery went well. Of course my OB called and said, hey, surgery went well. Never told him I coded, and I had pretty much flatlined. So he was a little perturbed about that. But so he rushed up to the hospital with the baby. And of course I couldn't feed her, which was really upsetting, but I could hold her, and which made things a lot better for me. And I was trying to get a hold of my mom to let her know that, hey, this is how surgery went. I'm out of surgery. I'm recovering. And the timing, the way it worked out, my nephew was graduating from basic training for National Guard the same day. So it was just, I think it was like family day or graduation day. So it was really hard to get a hold of my mom. And so I sent her a Facebook message. I'm like, hey, can you call me? Sent her a text message. Hey, can you call me? Finally waited 5 or 10 minutes, and I said, you know what? I'm just going to call her. So I called her, and she picked up the phone. I'm like, I love you. And I just started crying. And she's like, well, I love you too. And I told her, I said, you know, I really love you. I coded out during surgery, recovery as well, though. And we cried on the phone for a good couple minutes. We were both a blubbering mess, and it's one of those that you really take life for granted. And, you know, when things like that happen, it really puts things in a different perspective. So we talked on the phone. I explained kind of what happened during surgery, what we think happened, what they found, how I was recovering. And we said our goodbyes and hung up. And then I called my brother. I did call my ex-husband to have my son call me, my 13-year-old call me, after he got out of school. He's old enough, he should know. And I believe that's everybody I called. And then, of course, I just posted pictures on Facebook going, you know, I'm blessed, you know, and pictures of myself with the baby and the 2-year-old. And it, like I said, it really puts things in a different perspective for you. And the whole time, I literally was scared to even close my eyes to go to sleep because I stayed the night. And it was really hard. It really was, because I didn't want to close my eyes and then not wake up. You know, I wasn't sure what happened during surgery, and we weren't 100% sure that it really was the vagus nerve. So it was a really scary time, really. I ended up going home the next day. I want to say it was before lunch. My OB did come around 8:30 that morning. She had pictures. She did say I did have endometriosis, and I did have some endo on the back side of my uterus. And she explained to me what exactly happened. So they did it laparoscopic, robotically, whatever. So they put a scope in down lower toward my pelvis, or my pelvic area. And they started to inflate my belly with gas and air so they can see with the robot. And she didn't have any resistance when she went in, so she was a little apprehensive about it, and kept thinking, you know, she saw my heart rate dip, and she kept thinking, oh my gosh, did I hit her aorta? And so the other nurse, from what she said, was like, no, you're fine, or the assistant was like, no, you're fine, you're in there. And she was just a little confused because there was no resistance when she went in. So they ended up putting in the other scope, and as soon as they ended up putting in the other scope, the anesthesiologist was screaming, stop, I don't have a heartbeat, stop. And she's like, oh my God, I really did hit her aorta, I killed her, oh my gosh, she has babies, what am I going to do? And she wanted to just keep digging around to see if maybe she needed to pretty much cut me open to stop the bleeding if she did hit my aorta. And anesthesiologist was like, no, you got to stop, step back, you got to stop. And of course she's behind a drape, she can't see a whole lot. And she said he pretty much did like one-handed chest compressions as well as the precordial thump, which is pretty much you just like bang on the chest right there at sternum. And it's still pretty sore all throughout here. My muscles, like, it feels like I did a really bad chin up and just pulled all those muscles. And she said that my heartbeat started to kind of flicker a little bit, got in like the 30s and 40s, and then it flatlined again. And this went on for 30, 40 seconds or so. He did some more chest compressions. He ended up having to give me a shot. It wasn't epinephrine. It was like a glucose something or another. I have the name of it in my chart, but I don't remember what it's called. To get my heart back up. And it got back up, and it was in like the 130s, 140s. And of course she was kind of joking around going, oh my God, my heart rate is racing just like hers. And every so often she would kind of look around the drape and be like, okay, now her heart beats this, that's probably what mine is. Oh, now her heart beats at this, that's probably what mine is. And finally, you know, we all just kind of leveled out together. And but she said she saw some small fibroids. There was endo on the backside of my uterus. The right tube was pretty much fused shut, so that had something to do with endometriosis as well. And she was saying that pretty much I should not have either, one, gotten pregnant, or two, had a more difficult time getting pregnant. And I have 4 children. So the other thing, you know, the really odd thing is when she did the tubal, she pretty much took a chunk out of my tubes and then clamped them shut. And she said that my right tube as well was starting to fuse back together. So obviously I was meant to have children. Fertile myrtle, I guess. So, of course, she took my uterus. She took my tubes because she calls them cancer sticks. And then she took my cervix. And pretty much all she did was take all that and pull it through my vagina, pretty much. There's the graphic details for you. And when she does that, she has to do what's called a vaginal cuff. So she has to stitch all that up, pretty much. So, of course, nothing like falls out or I bleed to death, pretty much. And I really didn't need any medication. I was really amped to get off that morphine. I maybe took some Motrin. I don't think I took any Norco at all. If I did, it was like the day I left, like right before I left, because I was in super pain. But I think it was more of the gas pain, because they do pump you with gas and it just like radiates towards your shoulders, and it is just terrible. I did a lot of walking. I was sore in my incision sites, so I had a belly band put on so it was easier, especially when I was nursing, so that way she was not laying on my incisions. And got home, had some coffee, laid down. I don't really recall what happened a few days after that. I really could not tell you. But this past week, Monday, it was actually Sunday the 24th, so this past Sunday, I had some heavier bleeding throughout the day, and I just thought maybe because I had vacuumed, I was prepping food for dinner, I was getting up doing a lot of things, so I thought maybe I was just doing too much. So I took some Motrin, put a heating pad on, and it would kind of lessen throughout the day and then get worse and lessen and worse, and it just fluctuate back and forth. Well, 2 o'clock in the morning, I woke up to use the bathroom, and I had a big, like a tennis ball size clot that I passed, which was a little scary because I'm thinking I have a vaginal cuff, which is a stitch, so nothing should be coming out of that area. And it's pretty much how my cycles were. I had heavy cycles. I would have to call into work for like 3 to 5 days for almost my entire cycle because I had heavy cycles. And it was almost like my cycles all over again. And so after that, I didn't bleed. Nothing at all. Not one speck. I woke up again around 7:15, and this time I passed about like a golf ball size clot, so I wasn't too terribly concerned, but then I wasn't bleeding again. So I left a message on my doctor's website, like portal, patient portal, and said, if you can call me back, I don't know if I need to come in to be checked, I don't know if I have a tear, I don't know what happened, I don't know if I'm bleeding internally, give me a call back. Well, at around 10:15-ish, I was sitting here drinking my coffee, and I felt this gush, pretty much. Ran to the bathroom, and this clot was pretty much the size of a feminine pad. It was huge, and that really concerned me. I wasn't dizzy, I didn't have a fever, I didn't have the chills, none of my incisions were red, there was no foul smell, like anything that they tell you to watch out for, I did not have. So I instantly called my OB and I said, I need to speak to a nurse, here's what's going on. And she of course asked if I was dizzy, if I was having fainting spells, if I was like feverish, chilly, anything of that sort to rule out an infection or anything of that sort, and to not send me to the ER. So she said, just take it easy. We'll see you at 2 o'clock in the afternoon. And I'm thinking, that's like 4 hours away. I'm not sure I can handle having this happen again. So we went in at 4. I had not actually had any bleeding, or 4. We went in at 2, had not had any more bleeding since that humongous clot. I did take a photo of it to show my OB because I was not going to bag it up and send it to her. I mean, that just, no. So I took a picture of it. That way I can show her. Got in there, and she doesn't usually do vaginal checks after a hysterectomy until about, 4 to 6 weeks, if not 6 to 8 weeks, because she doesn't want to tear that cuff. So she was looking, had the speculum and everything. It's kind of like a pap smear all over again. She did see that there was some bleeding, but it wasn't active. And so she tried to apply some silver nitrate. That did not work. But as soon as she did that, it was like the floodgates open, and I was pretty much bleeding out on her floor. And so then she called for the nurse to bring Moncells, which is kind of like a paste or glue, pretty much. And she tried that twice, did not work, made everything worse. So she said, you know what, I can't do anything in the office, I can't stitch you up because I can't see what's going on, I don't know where you're bleeding from. And we went back to surgery. I had to be at the hospital at 4:15, so 2 hours later, and surgery was at 6 o'clock, I believe. And there was a different anesthesiologist came in, and this time he actually told me there are people who have a fight-flight system. When they get really stressed out, really amped up, they want to fight, they want to run away, they, like their heart rate goes up, their blood pressure goes up. And then there's those people that have a parasympathetic nervous system. That's me. Where their heart rate drops down, their blood pressure drops down, they pass out, they faint, they could have things worse, and I'm the dramatic kind, I guess. So he did tell me that there are 2 medications I can put in my IV to keep my heart rate up during surgery, which really didn't make sense because that didn't happen during my tubal. I have 8 tattoos, never had any of that happen. I've had a lot of dental work, never had any of that happen. I've even been put under for dental work, never had any of this happen. He did say that some people can, like, it can fix itself. Well, I come to find out after my surgery, this surgery, it did not fix itself. So he did go ahead and give me a pain medication in my IV. Gave me a medication to make me a little sleepy. And this time, instead of putting a tube down, he just did like a small tube with like a guard, so that way I can just kind of breathe on my own. But he had it just in case like anything happened. And then of course he gave me the medication to keep my heart rate from falling. Get in there, we're just chatting about in the OR. I move over to the other bed. I'm talking to my OB and she's telling me, hey, you know, we're not going to have any dramatics this time. I don't want to see you back in my office until your next appointment, which is in January. Yeah, and we're just casually talking. I'm talking to the nurse, I'm talking to the anesthesiologist. We're just casually talking. And then I remember he put the oxygen mask over my face, or the mask for the anesthesia, and said, you know, just kind of inhale and exhale, just breathe normally. Didn't tell me to count, didn't tell me to do anything. And I did that. I think I took 2 breaths and I don't remember anything after that. I want to say it was an hour later at 7. We were being wheeled out of OR. I was awake and I had this really bad like tar chemical taste in my mouth. You know, it's like when they're working on asphalt or tar outside and you just like smell it and get that taste. That's pretty much what it was. And he said, yeah, that's probably the medication to keep your heart from failing. So they gave me a cup of ice chips to have to kind of get that taste out of my mouth. And he told me when we got to the recovery room that that medication did not work. My heart rate still dropped pretty, like, dangerously low. So he had to give me another shot of it in my IV during surgery. And they did tell me that the vaginal cuff that the OB did was like a hair right there. She thought she was going to need 1 or 2 stitches, and it ended up being 4 or 5. So it was a significant tear. How it happened, not sure. I was coughing quite a bit after my hysterectomy surgery. I also have a 12-pound, almost 3-month-old that I'm carrying around. I had to lift up my 25-pound 2-year-old, which I'm not supposed to do, but when you're home by yourself, there's only so much you can do, and you have to kind of break some rules here and there. So I'm sure all of that did not help. And pretty much told me, like, wrote it on a sticky note saying if I ever have like my gallbladder removed, or if I have any surgery that needs to have my stomach inflated, or any surgery period, that I need to let them know that my nervous system is a parasympathetic nervous system. You can Google it. I will put some information down below in the details there. But that's pretty much how both my surgeries went. And I was on a strict minimal activity for 2 days. Well, of course, this is the week of Thanksgiving. So I was really stressing out because I had 3 kids home and I had to prep food for Thanksgiving, and I was supposed to not be doing anything, and I had no help, and broke down several times, cried, had my moments, got angry. And now we are 14, 15, 16 days out post my hysterectomy, I believe. 16 or 17 days post-op from my hysterectomy, and we are about 5 days out from my vaginal cuff repair. And the only thing I can really say based on recovery is I still am recovering. This is like the second day I've had makeup on in weeks. Is that it is tough. My body does tell me, hey, you need to stop, you need to slow down. I do get really, really crampy. I did keep my ovaries, so I do get crampy. I will still have that ovulation feeling, so PMS feelings, like bloated, hormonal. Pretty much the PMS symptoms that you would normally have during your cycle, I can still have because I still have my ovaries. But when I do too much, I do get really, really crampy. I've actually been on my feet for 2 hours now, and I am feeling crampy, like real crampy. So I have to go put a heating pad on. The vaginal cuff repair isn't bad. I just have to get up and walk around every couple hours. There is the sensation of what I call like a dry tampon feeling. shoved up there. But you know, that's pretty much how it feels. If you're a woman and you have worn tampons, that is the exact feeling I have. Not comfortable, the least bit. But it's repaired. It should heal, hopefully, pretty quickly. And from what I understand, it could take, you know, at least a week, maybe 2 weeks to heal completely or dissolve, like those stitches dissolve. I do see my OB in about a month to just check everything. And knock on wood, crossing my fingers, I don't have to go back for anything else until then. But that's pretty much my recovery. With hysterectomies, you can get what's called swelly belly. So if you do too much, you can get that bloat look to it, to your belly. I tend to wear a belly binder when it gets to that point, so that way it can hold everything in, per se. But that is how my recovery has been, and that's where I have been. I have been on a hiatus from YouTube, from any live videos, from pretty much life for a few weeks now, and still trying to take it one day at a time. And when things get rough, I just have to sit there and say, you know what? I'm alive. I would not be here if it was not for the anesthesiologist, and I am here to share my story. And for those that have parasympathetic nervous systems that can, you know, have stories similar to mine, please comment down below. I don't want to feel like the only one out there. I know I'm not the only one out there. It's a very scary situation to be in, knowing that any type of surgery or any stressful situation I may be put into, that could happen. And I think it was even brought up of, even one of the nurses, I think, brought up of probably talking to my doctor about having like an EpiPen for, you know, that kind of situation. But like I said, I've had dental work, I've had tattoos, I've had certain things and been under those situations and never had this happen. So I'm not sure. It's like a big medical mystery. But that's my recovery in a nutshell. Hopefully, it's almost 30 minutes long. Hopefully you guys are still with me, and I hope this actually loads. But if you have any questions about my hysterectomy, if you have any questions regarding any type of hysterectomy surgery, and you're going to go through it or you went through it, comment below. Let me know that I'm not alone. Let me know where my hysterectomy sisters are. And, you know, if you've been through this, take it one day at a time. Relax. Ask for help. Don't be afraid to ask for help. And just take it easy. Until the next video, ciao.